Hello, welcome to Massey Dialogues. Bienvenue au dialogue du Collège Massey. Massey College is a place for ideas. It has for mission to nourish learning and serve the public good. Massey College, the physical college, is located on Indigenous land, the cherished land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. And we are very grateful for the ability to continue to do our work here. At this time, I think Massey College is struggling, like many academic institutions, to respond in an appropriate way to anti-Black racism. And we will continue to put that on the agenda. We will have a Massey dialogue specifically devoted to this issue next week. But I'm sure that today, as we speak about the impact on women of the COVID crisis, on how we could imagine a feminist recovery, I know that my guest, my very special guest, will want to address as well how Black women are really at the forefront of our thoughts today. So let me introduce our guest. So I have first Maya Roy, who's the CEO of the YWCA Canada. She's a member of Canada's expert panel on early learning and childcare. She's one of Canada's top 40 under 40, and she was and is a World Economic Forum Young Global Leader. I am so delighted to have you. I've read your work. It's really, really important to have you here. And she is accompanied by Anjum Sultana, who's the Director of Public Policy and Strategic Communications at the YWCA, but she is also an alumni from Massey College. So I'm delighted to have her here as well. I also want to say that we were going to be joined by Chantal Phillips, who is a second-year medical student at the University of Toronto. She has a great passion for equity within medical school admissions and medical school curriculum. She is one of the two co-presidents of the Black Medical Student Association. She's been great in leading an anti-oppression movement on curriculum and within Massey. She just sent me a statement because she has been diagnosed with the coronavirus, so she will not be able to participate live to our meeting, but she has sent a very wonderful statement that I will read to you when we get a little bit later in the show. So let me just start with Maya. So Maya, I think we've said that before, but I think that the YWCA has been kind of digging the evidence on trying to assess what has been the impact on women of the COVID pandemic.
Mm-hmm. Thank you so much. And again, very, very pleased to be doing this show with you this afternoon from Haudenosaunee and Anishinaabeg land. Absolutely. YWCA, we have 32 local community YWCAs right across the country. And what I'm definitely hearing from my colleagues on the ground is not only have they seen an increase, for example, in intimate partner violence, gender-based violence, it's also more challenging to actually get connected to services, or for example, if you need to leave an abusive relationship. So for example, if your community has very, irregular public transportation or no public transportation at all, how do you actually get to a shelter? If you're in an abusive relationship, and the partner is controlling, for example, your cell phone or your data, how do you even have access to information? We're also hearing right across the country, because reopening is happening at such different rates, how do you get a protection order or a peace bond or a restraining order if the courts are closed? So we're certainly seeing it along the full continuum across women's relationships. And I think we're also seeing that this pandemic is exposing what's already broken in our society. We all know, and that's why it's very important. I appreciate, Nathalie, how you did the land acknowledgement at the beginning. Because of ongoing colonization of Indigenous communities. 60% of Indigenous reserves don't have access to clean, running, and potable water. So when we're asking communities to wash their hands regularly or physically distance, we know, for example, not too far from Massey College, my former community of St. Jamestown that I love dearly, sometimes there's 2 to 3 newcomer families in a 1-bedroom apartment. So it's easy to physically distance when there's some privilege or when there's some economic support, but we're also finding with the pandemic that it's the most vulnerable who are actually suffering the most.
So I think we know that. I think that we have heard about how the pandemic has shown a light on deep inequalities that have just been exacerbated by the pandemic, whether it's lack of adequate housing, lack of access to green spaces. And also, I think we had someone discuss a little bit the impact on elder women who are in long-term care, and also the women who are in the service industry, that are the cashiers, that are the nurses, and the front line, and the people that the cleaners that are really at the front line of this pandemic and as workers. So have you been, as the YWCA, done some work on this to identify it? I know that we want to talk a little bit about the recovery and a feminist lens to the recovery, and I'd like to hear you on that as well.
Yeah, absolutely. And I think I have Anjum as a colleague, as our director of policy as well. She's now just a junior fellow at Massey. And I think what's been really important for us is we have our colleagues on the ground, whether it's 2,000 units of affordable housing or 34 shelters that YWCAs are running. So how do we work backwards from that, look at some disaggregated data? Because you're absolutely right. We can't really start thinking about recovery until we actually know what's happening now. You had mentioned that it's mostly women who are working in service occupations or cashiers or in healthcare, and you're absolutely correct. If you look at the April 2020 unemployment numbers that came out through StatsCan, it's predominantly women who are being impacted by COVID, but then also having to pick up the double duty of care, whether they're dealing with an elderly parent or caregiver in long-term care, or having their hours cut back. So even though we're at, unfortunately, almost 18% unemployment in April, that still doesn't count a lot of people who've had their hours cut back, and it's impacting their ability to pay their bills. We're definitely seeing that impact in terms of mental health, because I think one of the ways we get through things is together. So, for example, our service users in our shelters have been amazing in helping us, for example, move cots in homeless shelters, more than 6 feet apart. But it's really challenging now. All of a sudden, for example, if you're going to go to the grocery store, there could be potential exposure. So one of the things we did, one of our colleagues in Calgary, very early on in the pandemic, she was great in sort of sending us some of the humanitarian aid literature that is out there. And I found it really helpful to look at, the almost like the stages in crisis that we go through, not just as an organization, but also as a person, as a family, as a community, when any kind of crisis like a pandemic hits. And it was very interesting that it sort of talked about that denial stage, but then almost like a potential honeymoon stage while, all of society is reorienting. And it led to some, as challenging as it's been, it's also led to some pretty, incredible partnerships or people coming out of the woodwork. So, for example, we were trying to figure out in early March how to get PPE, how to get hand sanitizer and personal protective equipment to our essential workers across the country. Shelter workers are still working, and there's a local craft brewery in Oshawa. They actually switched production to hand hospital grade hand sanitizer So we partnered with them, and then Global Medic, which is an international aid organization made up primarily of paramedics. I don't know how to do supply chain management, but they do, and they have a partnership with FedEx. So next thing you know, they're shipping hand sanitizer out to shelters in the Arctic, both YWCA and also additional organizations in the community. So it's been really challenging, but it's forcing people to come together and work together and find new solutions. But the problem is, as you pointed out, it's the most vulnerable in our communities, whether it's women living with disabilities or Indigenous or Black women. We also know that for many women, being forced to be in lockdown is also a death sentence. Yes, all of these physical distancing measures are really, really important. But as we're seeing with, these so-called, wellness checks across the country, both in New Brunswick and in Toronto, and now also in Winnipeg, we've had Black and Indigenous community members die when the police were called for a wellness check. And it's leading to quite literally a global movement, the continuation, but a very focused global movement around shifting policing and naming anti-Black racism.
So I want to bring in Anjum a little bit on this conversation. She's the one that convinced me that we should be talking about an economic recovery plan,
yes,
but that would kind of come from a feminist perspective. What does that mean if we want to do economic recovery from a feminist perspective? Anjum.
Yeah, so I think to highlight some of the economic impacts, an economist, Armin Yelnazine, has been talking that this is not just any type of recession that we're going to be embarking on or experiencing as a society. This is going to be a she-cession. And the reason for this is that the economic impact is going to be disproportionately felt by women, two-spirit, and gender diverse folks. And so we're seeing, like Maya mentioned, astronomical job losses. So in March, 63% of the job losses were accrued by women. And we're also seeing now, as society starts to open up, the employment rates are increasing, but not the same for women as compared to men. So employment actually increased by 1.1% in the month of May. For men, it was 2.4.
So why is that? Why is that?
Yeah, so a great question. So part of it is that women have been concentrated in sectors such as retail, hospitality, tourism, food services. And so with some of the new measures where we have to do physical distancing, you can't have the same number of people, for example, in a restaurant as you did before. Staff are not able to come back at the same rates. We're also seeing this, for example, like Maya was mentioning, we have essential workers across the country. One of the services we provide is childcare. So some of our childcare centers across the country, for example, the province of Ontario, they're opening back up, but they can't take on the same number of children. So, that's something that is going to impact employment numbers. So I think something else we have to think about is this is going to start to transition us to a contactless economy. And there's the jobs that were lost in March and April, we're not going to get back necessarily during the summer. Some we will get, but not all. So what happens to all those women? Where will they go for work? So one of the things that we've been talking a lot about, this is before the pandemic, but now it's even more important, is how do we reskill and upskill women so that they can access jobs of the future, whether it's artificial intelligence, whether it's actually more investments in the care economy. When I think about what is saving us during this crisis, it's been things like care for elders, right? Long-term care. That's becoming a place where we know we need more workers. It's been places like childcare. Armin Yelnazine has been talking about this is a she-cession. We need a she-recovery, but you can't have that without childcare. So that's going to be essential. So where the workers are going to staff that. We've also seen, organizations such as ours, charities and nonprofits, having to do more with less. So I think one of the pieces or pillars of a feminist economic recovery plan will be investments, robust investments in the care economy and starting to transition jobs there, because that's actually where we need more workers. So that's one piece, and I can share more and expand.
Well, so and Maya, so you're an expert in childcare. So we've been wanting a national childcare policy for a long time. Is the Feminist Economic Recovery for Canada require a national childcare strategy?
I think absolutely it is fundamental. As Anjum mentioned, if there's one thing that has come up is the importance of childcare in order for parents to go back to work. And that's really challenging when you don't have a national system. It's really challenging when you have different kinds of standards across the country. We do have some really interesting policy frameworks. For example, many Indigenous, Métis, First Nations, and Inuit organizations have developed an Indigenous early learning framework. So we're not having to start from scratch, and especially, speaking as a first-generation Canadian, when Indigenous communities benefit, that those kinds of sort of ripple effect happen for childcare. For example, I ran care for newcomer children for over 8 years. So it's very interesting because we're starting to also see more and more individuals in the private sector really understanding that if they, even with the recession, there's enough acceleration of job loss due to automation that at the end of the day, employers still need some kind of a care plan in order to retain and attract and pipeline talent. So you absolutely, you need that. If you don't know where your children or your elderly parents are going to be. And I think one thing for those of us, for example, who've been talking about parenting and childcare and sort of workplace flexibility for many, many years, it's interesting. It was also really interesting to see with the pandemic how many sectors of the economy was able to all of a sudden work from home overnight. Yeah. And for parents asking their employers for years to be able to do that, to be able to better manage their work and care responsibilities, the irony of that has not gone unnoticed. So we see it at one end of the life cycle with childcare, but as we're also seeing people are dying in this pandemic in long-term care homes, or as a close friend of mine refers to it, Tabby, as senior storage. So if we don't, as a society, come together and talk about the really importance of public care and have the clear social policies and the funding arrangements to go along with that, we're going to continuously see how we're all in this together. We saw, for example, in Singapore, they thought that their first wave was actually complete and started to relax, but they had, as a nation, their planning government had completely ignored newcomer and migrant laborers from the Philippines and Bangladesh. And a second round of outbreaks came from that. So when we ignore the most vulnerable, we ignore ourselves at our own peril.
So the first pillar, or one pillar, is certainly childcare. The second pillar that Anjum mentioned was the retooling or the tooling of women to be in the new economy sector. So I'd like to hear a little bit about that. And finally, I think what you're talking about is a real investment and a real good jobs in the care sector, which women have been wanting to do that for a long time because they're doing the caring in the nonprofit sector in many aspects, and it's often undervalued. So is that what does, when you're talking about the Feminist Economic Recovery Plan for Canada, are they priorities that you want to see?
Absolutely. Access to universal childcare is one. I think the other is also looking at how can different stakeholders come together and test some innovative solutions. So our colleagues at YWCA Banff, they actually have a social enterprise hotel. All of the profits from the hostel actually go into go into services for women leaving partner violence. It's been really interesting to see in the last few years. They've been working with a local childcare provider, Puzzles, and the predominant parts of the economy, the local tourism and hospitality operators, and they've actually started giving they have a whole daycare there essentially structured around people working shift work in the Banff tourist economy. They've also adapted that care model now that many people are out of work and Banff starts to slowly reopen. So I always sort of point to Puzzles and Banff because it's a really interesting example of what happens when, for example, the hotel industry, a nonprofit childcare operator, the YWCA, and local businesses come together to say, you know what, this is what we need for the economic engine to run, and definitely childcare is one of them. I think Anjum can speak maybe a little bit around some of the benefits recommendations we were making in terms of policy changes.
Absolutely. So I think first and foremost, I think one of the challenges has been, this has been historical, but we're really seeing this come to a head during this crisis, is that the people most impacted are never in positions of leadership. And we're seeing this across multiple countries, but we really need a gendered balanced economic recovery task force. We've seen a good model, for example, is for G7 nations. Whenever a G7 summit has happened over the last 2 years, when Canada has hosted it, they were actually the ones who brought this forward, and France continued this past year. There's been a Gender Equality Advisory Council. That could be one of the things that we have for Canada for this economic recovery and beyond. I think we need to ensure that every single policy that comes out to address the crisis, but also the recovery, needs to have an intersectional gender-based analysis. And we haven't seen that necessarily during this crisis. And one can argue it is a crisis, right? So things are moving so quickly. But if we ignore this, like Maya was saying, we ignore it at our peril. So an example of this, for example, is CERB. Initially, when it first came out, this was a very important measure, but many advocates were saying it's very difficult that people have to make zero income to access it. And so there's been changes since then, because we know women, for example, lost hours during this crisis in terms of their hourly wages. They might have had reduced hours. And so many women, for example, could not access CERB in its first iteration. But if we were starting to think about public policy, not just afterwards around the differential impact, but in the creation of policies, this is a lens that we would be able to address some of those missing gaps. So that's first and foremost. And the other piece I will share, Maya's spoken a bit about the gender-based violence piece, but a key pillar for us is actually making robust investments in prevention of violence, harm, and oppression. So gender-based violence is one of them. We've talked already a bit here around anti-Black racism and anti-Indigenous racism. That needs to be something we cannot ignore, because in many ways, these are the shadow pandemics or the pandemics within the pandemic. And I would say I can come back to the jobs piece, but another key piece is previous recessions have focused a lot on infrastructure as a way to get us out of the recession, right? Like build more roads, build more bridges. What we would argue is we need to build more housing, affordable housing. Yeah. We need to build more shelters. Right now, the National Housing Strategy has a target that 25% of it should go to gender-focused investments. Let's actually make that a reality. That's our target. Let's make that happen. So we would say more housing, but not only that, more transportation. And since we're all working from home, we need better internet, especially in rural, remote, and northern communities. So that just gives you a snippet of some of the things we can invest in a feminist economic recovery plan.
But the recovery plan that you're presenting, the feminist recovery plan, is not that different than what is already on the books. Like how different is it from what we are hearing in terms of a possible recovery plan that would be more anchored in social justice than before? Is that is there a difference that you're bringing to the equation?
Yeah. So
you also go ahead. No, and you raise a good question, because we're not proposing anything that, isn't sort of tried and true and evidence-based. Absolutely. But I think part of the difference is also we need the disaggregated data. The U.S., for example, does collect race-based statistics. So we actually know how can we actually start to address anti-Black racism if we don't have a clear understanding here in Canada. We know in the States, for example, that it's predominantly minority, immigrant, and Black community members that are being impacted by COVID. In Canada, it's much fuzzier. And we do, for example, collect race-based statistics, for example, around HIV. Maybe don't do the best that we could in terms of how we use that data. But I think I agree with you, if a recovery plan is really going to have more social justice, we need to prioritize those who are being impacted the most. So, for example, one of the things that came to us early on at YWCA is quite a number of collectives and organizations of women led by and for sex workers were very clear to us that they could not access the CERB. So what could other supports look like? And many of those organizations like Maggie's and Swan and the Butterfly Network, they've actually been doing fundraising to do direct cash transfers. So I think, it's unfortunate, but there's a real hierarchy of how women are experiencing systemic discrimination and how they're being impacted by COVID. And what we're trying to do is put their concerns and issues and integrate it into our work as well to see that how can we provide support as a national women's organization.
So that's the important part that I'm hearing as well, is because you're a national organization, you see both the innovation part that comes in different regions of the country, but also the severe hardship that's unequally distributed. Have you been able to look at and assess the different strategies of recovery and whether they have different impacts on women?
Unfortunately, not at a broader quantitative measure, and the data nerd in me would love that. So if anybody, whether it's at Massey or at Monk, have that table, I'm happy to come and sit and volunteer my time. We are seeing it on a qualitative level. So, for example, during the pandemic, we're seeing increases in gender-based violence right around the world. They've put in place special mechanisms in Italy and France. For example, a woman can say a code word at a pharmacy. But guess what? We have a homegrown solution in Northwest Territories. There, as part of the protection order system there, if there has been domestic violence, it's actually the perpetrator who's removed and taken to a hotel. And the woman and the children can actually stay in the home during a pandemic. That's even so much more important. So it's interesting for us, and we have sort of been logging all of these kinds of solutions to kind of sort of nudge and say, hey, what do you think about this? Some of our colleagues in the prairies and, for example, in Hamilton, they're still in the case of where there's been divorce and there's an access center. They're actually doing remote digital access. So that, both parents can still have access to the children. So it's been sort of interesting finding different ways to adapt, but it's also making us ask some tougher questions and maybe think about, again, as a women's organization, if we're doing work around providing shelters for women leaving abusive relationships, at the end of the day, we want to, drive ourselves out of business. Yeah. So I find the solution in Northwest Territories really interesting and possibly a way forward in Canada, because if that's centering the well-being of the family and the entire community, maybe that's something we need to look at, and then also have the longer-term strategy around the affordable housing. Because if a basement apartment rent was $3,000 before the pandemic, now to be honest, I'm seeing even worse numbers.
So the housing has always been an issue that for women, and for the YWCA has been at the forefront of trying to support this. Violence against women has been one of your calling cards. Now that the people are asking for defunding of police services, how do you react? Have you had the time to assess what will be the impact on some of the services that you provide or that you could provide?
Right. That's a really good question. I think for us right now, we've moved into a stage of listening. Traditionally, our organization has not had leadership across the country. I mean, I'm very privileged. My predecessor identifies as a Black woman and really very much brought these issues to the table. But in terms of us as an organization, we're very much right now in a listening mode. Certainly the discussion around defunding the police is happening. And as our colleagues in Indigenous women's organizations have been saying for many, many decades, and what we see with the Missing and Murdered Indigenous Women and Girls report, there are some real systemic issues with how the RCMP treat Indigenous, First Nations, Métis, and Inuit women across the country, and it's problematic. So, if people, especially during a time of crisis, if they're having really intense conversations and pushing forward policies that are actually going to get the job done, when after many, many decades of reform has not. Personally, I can't speak because we don't have an official policy on this yet, but personally, I'm absolutely there for the conversation and there to provide support to the community.
Well, it's interesting because I think we all are trying to hope that at least if there is the idea of defunding is that the money goes to services that are needed. We wouldn't want these services to continue to be underfunded
right.
and have even less access to protection. So
absolutely. I mean, my colleagues in shelters will tell you, especially in some smaller communities, if a partner is abusive but also a member of the police, it makes it extremely challenging for the woman to leave and to leave safely and alive. And we also know through the research and just our experiences as shelter workers that if someone has a predilection for their interest in police activity or might have access to a gun, the risk to the women and the community simply skyrockets. And unfortunately, we saw that horrific pattern happen yet again in Truro, Nova Scotia, just a few weeks ago. And the ex-partner, the woman who survived that horrific incident, she's been very upfront in speaking to that as part of her advocacy work.
Well, I think we knew that from a long time. So it's interesting that at this moment of crisis, many of the ideas that had been put forward by women's organization or by different organizations, civil society organization, are now maybe going to have to be evaluated, since there's an opportunity for change here that people don't want to miss. So let me bring Anjum back a little bit about how she sees the future. What would she like to see within the next year to be done to really embark on an economic recovery that that cares about women?
Great question, and thanks so much for this conversation, because I think what we've seen over the last 3 months is a policy window open that has not been open for many, many decades. And so I think this is the opportunity that civil society really wants to leverage to build that momentum, to build back better, as some folks are saying, as the UN is saying, and as others are saying. I think also we need to ensure that the next time a crisis like this happens, we are better prepared and have that proactive, upstream, and transformational approach. And that's what a feminist economic recovery plan also is putting forward, is a new way of working, a new way of actually addressing situations. And Maya spoke about this quite a bit as well, around the importance of intersectoral partnerships. I think too often in society for the last little while, we've started to see some collaboration, but that has really come to a head during this crisis, where how can government, private sector, civil society, and public service come together? That is also part of the intention behind this plan, is that this is an offering, but this is by no means exhaustive. And I think it also is calling on us to reevaluate what do we see as success. I think in the past, coming out of a recession, it might be job numbers, it might be, GDP, but now we want to really put the focus on the social measures of success. Mm-hmm. Is homelessness going down? Because we know how important that is to address during a pandemic. Is gender-based violence going down? Or people's fear of gender-based violence going down? For example, Stats Canada did a poll during this pandemic and found that 1 in 10 women are fearful of gender-based violence. That is a number that should not exist. So that is also something we should be evaluating in our economic recovery, because when people are fearful of violence, of hate, of oppression, that's not good for the economy. That's not inclusive prosperity. So that's something also we have to think about. It can't just be numbers without context. We need to include the full picture of someone's social, economic, and political life.
So I want to bring in the perspective of Chantal Phillips. I mean, she was really nice enough to send me a statement here, and I'd really like to read it. So Chantal, as I said, is a medical student. So she starts, as a woman in medicine, I am aware that even though my class is 57% women, and this may deem a hallmark of equality for some, we still face a variety of challenges. This includes a gender pay gap and increased rates of mental illness among female physicians compared to their male colleagues. In addition to having no formal maternity leave policy or paid leave, female doctors take a larger proportion of parenting and domestic tasks than their male colleagues. While children at home, the need for increased domestic support during COVID has likely exacerbated this discrepancy. In 2018, results from a National Physician Health Survey showed that female doctors had 23% higher odds of experiencing burnout and 32% higher odds of depression than their male colleagues. With this, we can acknowledge that there are ways that the field of medicine, it's often unacknowledged that there is a history of patriarchy, colonialism, and anti-Black racism that makes us all sicker and turns us away. This manifests in female physicians reconsidering their career paths, reducing their work hours, and considering part-time work in medicine. And then she goes on, and I think I really want to use her words here because they're very powerful. Although these issues are not to be ignored, conversations about gender pay gaps and glass ceilings and their occupancy at the center of conversation regarding women is a little bit bourgeois feminism. To focus on these issues that will likely affect me as a soon-to-be medical graduate instead of the issues that plague me as a Black woman in Canada would do a disservice to any feminist economic recovery plan. She then quotes Angela Davis that says, any feminism that privileges those who have privileges is going to be irrelevant to poor women, working class women, women of color, and trans women. If standards for feminism are created by those who already have ascended economic hierarchies and are making that last climb to the top, how is it going to be relevant to the women who are at the very bottom? So I want to just continue with, because she wants to speak a little bit of Black racism. So I think she continues to say, and quotes the feminist theorist Chandra Mohanty, and says, we must anchor ourselves analytically in the lives of the most marginalized communities. And I think you have said that because this provides the most inclusive paradigm for thinking about social and environmental justice. Who sits at these tables and makes these decisions about social programs without engaging and centering Black and Indigenous, migrant, and trans women of various intersections and tax brackets in the conversation about feminist economic recovery, we risk perpetuating the exclusionary history of feminism and focus on glass ceilings instead of on the Black and Indigenous backs that we are stepping on. For this time, and then she has a direct message to the Massey community, I exhort Massey College to reflect on its history and present-day anti-Black racism and how in silence this ever-growing elephant in the room balloons and strong arms Black academics to the margin to our collective detriment. We cannot put our money where our mouth is without first hearing mouths in opposition to and committing to fight against anti-Black racism. So thank you very much, Chantal, for putting this statement out. I was very proud to read your words. And I think it brings us a little bit to, I think as the YWCA has always been, which has been to put forward the lives of many women who are silenced in society that couldn't be heard. If you weren't there, many women that are in shelter would never get a voice. How do you see yourself in the future as the YWCA? I know that Maya says, well, in an ideal world, we would put ourselves out of business, but how do you see yourself as being a voice for women?
Mm-hmm. I think I wish we could let Chantal have the last word. In fact, I think what she spoke about in her statement, that's essentially what we need to do as an organization. And it's not until Black and Indigenous women internally, whether it's part of our leadership or sitting at the right policymakers' tables and are making those solutions, that will also truly, we won't be effective as a movement until that happens, essentially what Chantal describes in her statement.
Mm-hmm. Well, it's what are the challenges at YWCA? I mean, it's like many organizations that started a long time ago, but it has evolved a lot. And what are the strategies that you're developing to ensure that the voice of intersectionality are heard?
Mm-hmm. When I first joined the organization, I was asked to work with our partners, both internally and externally, to look at a strategy around reconciliation. We were very privileged to have a number of elders and knowledge keepers on our board and as frontline staff right across the country. And one of the women, Kim, was very intentional in saying to me, and I sort of always carry her teaching with me, where she kept reminding us, we can't have reconciliation without truth. And I think that's really, really important. One of the things that we're doing internally, so this year officially is part of our 150th anniversary, but we were uncomfortable celebrating or talking about this without having a clear understanding of the truth. So we've actually hired a number of archivists to go through our archives and essentially pull together what is our history as an organization in the past 150 years, and have that inform how, what kind of anti-oppression training that we need to do, what kind of equity work that we need to do, for example, making sure that we have suppliers that also represent Black and Indigenous entrepreneurs. It's not simply about being at it from a charitable perspective, ensuring that we actually hire, train, and promote from diverse communities. So it's going to take us on quite a journey, I think, over the next 24 months. But I think it's about actually looking inward. And as my colleagues are continuously reminding me, we have to hold ourselves to a higher standard. So how do we do better? And how do we hold ourselves to a higher standard so that, yes, we have our first 150 years, but that over the next 150, that we're essentially doing the work that Chantal outlined in her statement.
So it's wonderful to hear this. I think many organizations will want to take some lessons from that about looking deeply at their own history, looking at the new strategies that they need to develop to actually combat anti-Black racism in a real and effective way. I see that. I think we all want to acknowledge the great impact that Chantal's statement has made. So maybe I'll just kind of allow you to conclude a little bit. What are the things that you'd really like the audience to know about thinking about the recovery plan from a feminist perspective, from the YWCA's contribution? Anjum, let's start with you.
Thanks so much. I think the biggest piece of the puzzle is that we really need to have representative decision makers drive the recovery. I think if we have recovery decisions not amplifying the lived experience of people who are the most affected, we will not have a recovery that works for everyone. There's a lot of calls for an equitable recovery, for a healthy recovery, for an inclusive recovery. From the work that we do, we put forward the feminist piece, but for us, we cannot have a gendered approach if it's not intersectional, because we live multidimensional lives, and so we need to have that at the core. So that's a key piece. And the other piece that I would like the audience to kind of take with them is, are the jobs that we currently have structuring our society working for us, or do we need to invest more robustly in the sectors that have been saving our society during this time period? Care for us is fundamental. And so what I'd like to see is, how do we start to transition our economy in that direction? Part of the challenge has been feminized labor, or sectors that have been traditionally women majority have been devalued and undercompensated, but we're seeing how critical and essential they are. So we want to make sure that essential workers are not sacrificial, that they're actually deeply valued. And I think that is something we'd like to see moving forward as well.
Maya, any concluding thoughts?
I would just say, I think Chantal and Anjum named it really nicely. I think I would say that the only way we're going to get through a pandemic and recover, feminist or otherwise, is through community. It's not going to be the stock market that's going to save us. And I know we're all waiting for a vaccine, but I've seen firsthand at Massey College how you build community. I ran a settlement women's organization for many years, and we would actually have our book launches for the newcomer women in your great hall. And Massey fellows and students would come out and chat with us. And it was really important, because it was racialized and or newcomer young people essentially taking up space and looking at Massey. So I think as an organization, we're certainly turning inward. And I think, to echo Chantal's comment, how can we turn inward and do better and hold ourselves to a higher standard? Because if we can actually model that work and do the work well and authentically, the real change is actually going to come from there.
Thank you. Well, I want to thank you very much for being part of this conversation. I think we will want to continue to look at the way in which we measure success of our recovery, not just in GDP terms, but also in social justice terms. So I look forward to continuing to read about the good work that the YWCA does. And I hope that you come and celebrate the great work that you're doing at Massey as well. I want to thank the staff that is putting these Massey dialogues, Matt Glenfield and Abra Rissi. Thank you very much for all the work that you're doing. Thank you to Chantal Phillips for, despite your illness, putting forward such a strong statement. Thank you very much for being part of this community and standing up for what is right. I want to talk a little bit about the upcoming dialogues. We're coming to the end of our season. On Thursday, we will talk about COVID diplomacy, how indeed the world of diplomacy has changed. And we were going to talk about art diplomacy, the role of culture, cultural diplomacy, how culture is impacting the way in which we relate to one another across the globe. And I can't wait to hear the Jeff Bryson and his team describing their work on this topic. Next week, we'll start on Monday by inviting and having a strong discussion on anti-Black racism. So I invite you for this. We will have Dr. Alyssa and members of our community to be there here and talking about anti-Black racism. On the 16th, we will talk about the role of cities, and we're doing this with the Monk Center. And finally, we will have the American ambassador on our last day speaking about relationships with Canada. Let me just make sure that I have the right description of our anti-Black racism because it was not in my inbox here. So let me just make sure that I have the right description. It's on the calendar, and we are still trying to make sure that all the voices are being heard on this. Dr. Lisa Robinson and Alisa Truss will be there. Thank you very much, and I look forward to seeing you.